Hi, it's Bree Smith, SN, here to help you succeed in nursing school and on the NCLEX.
In this video, we are covering a wide variety of gastrointestinal drugs, so check the chapters and timestamps to help you find specific ones you are wanting to focus on. Let's begin. In this video, we will begin with discussing drugs that are used in the treatment of peptic ulcers, with many included here also indicated for indigestion, heartburn, and other related conditions. Our prototype histamine 2 receptor antagonists are cimetidine and famotidine. Think that when people with heartburn dine, they need these drugs, which include the word dine. They function by increasing gastric pH by decreasing acid production. As this change in pH may interfere with absorption, other drugs should not be administered within about an hour of these drugs. Also note that cimetidine can lead to an unusual side effect amongst the older adult population, creating confusion. Omeprazole is our prototype proton pump inhibitor, which also acts to reduce acidity by interfering with the release of protons needed for the creation of gastric acid. As a side effect, this may impair calcium absorption in the intestines, placing long-term users of this drug at increased risk for osteoporosis and bone fractures. Patient education should emphasize adequate calcium and vitamin D intake, as well as incorporation of weight-bearing exercises. Eating food at the time of administration may impair absorption and not give the drug enough time to begin working before digestion is initiated, so food should be eaten about an hour before the drug is taken by the patient. Sucralfate is a mucosal protective agent. The way to remember this one is to think about a slimy frog in fairy tales who is fated to become a prince once kissed by a princess. This drug coats the lining of the stomach mucosa, coating ulcers to create a barrier between them and the corrosive gastric acid. This drug should be taken 1 hour prior to meals and at bedtime, and other drugs should be taken separately to allow for adequate absorption. Our prototypical antacid is calcium carbonate, which directly neutralizes gastric acid due to being a basic substance. Like the rest of these drugs, antacids interfere with absorption of other drugs, and so time of administration should be spaced out anywhere from 1 to 2 hours. Overingestion of calcium carbonate may lead to unpleasant side effects such as constipation and renal calculi. Patients should be educated to take as prescribed, limit over-the-counter use, and drink sufficient water. Our last drug we will cover for this section is misoprostol, a prostaglandin E analog, which functions by increasing vasodilation to the gastric wall, decreasing stomach acid secretion, and increasing the production of mucus and endogenous bicarbonate. Those familiar with L&D drugs may recognize this drug as one that is used in the induction of labor for the purposes of cervical ripening. When considering its use as a GI drug, however, misoprostol is used as prophylaxis for gastric ulcers linked with long-term NSAID use. Ensure female patients have a negative pregnancy test before administration, as taking this drug while pregnant and not in active labor may lead to spontaneous abortion of the fetus. On to antiemetics, which are commonly administered in clinical practice, so be sure to be familiar. First is ondansetron, a serotonin antagonist, which stifles the triggering of a section in the CNS that triggers nausea and urge to vomit. This drug is indicated for scheduled use, given prior to anticipated episodes of nausea, such as prior to chemotherapy, for example. Common side effects to expect include headache and feelings of dizziness. Long-term use may be associated with extrapyramidal side effects, as well as anticholinergic side effects. Dimenhydrinate is an antihistamine, providing antiemetic effects by blocking histamine receptors in the inner ear and also stifling the triggering of the CNS center for nausea. This drug is indicated for the prevention and treatment of motion sickness, vertigo, and related emesis. As an antihistamine, anticholinergic side effects are expected. Drowsiness and sedation are also expected, and so this medication should not be taken prior to engaging in activities which require mental alertness. A potential unique reaction is the paradoxical hyperstimulation rather than sedation, which may present in some pediatric clients. To promote safety, instruct patients not to operate heavy machinery while on this medication, avoid the use of other CNS depressants, change positions slowly, and incorporate comfort measures to deal with anticholinergic side effects. The final antiemetic covered here is the prototype for prokinetics, metoclopramide, which works by stimulating gastric motility and increasing the rate of gastric emptying. Delayed gastric emptying, such as with gastroparesis, contributes to feelings of nausea. Remember this drug by thinking of a metro, which can get you places faster. With this, hypermotility is a side effect that can lead to unpleasant intestinal cramping and diarrhea. This drug drug impacts the dopamine cascade, and thus long-term use increases the risk for extrapyramidal symptoms. Ensure the patient is not presenting with any form of intestinal obstruction, perforation, or ulceration prior to administration. Taking this drug with the aforementioned complications can place the patient at risk for perforation and hemorrhage of the GI tract. Now onto drugs which are used in the treatment of constipation. First is psyllium, a bulk-forming agent which facilitates the absorption of water into the stool to allow for easier passage. Patients should be instructed to drink at least 8 ounces of water with this medication and sufficient water intake daily, or else impaction may occur. Excessive use of the supplement can lead to the counter effect of diarrhea. A common contraindication we will see amongst all of these drugs is to avoid administration in the case of severe impaction or obstruction. Doing so can lead to potentially severe distension, intestinal perforation, or even hemorrhage. Next is the stool softeners, docusate sodium and senna. These are emollients which soften the stool by reducing surface tension and allowing for easier passage and decreased strain. You will see these used to help prevent straining, as in the case with patients who are at risk for or exhibiting increased intracranial pressure. These also may be used for patients on narcotics, as constipation is a side effect of opioid use that does not minimize with continued use. Like before, excessive use can lead to excessive motility and diarrhea. Alert patients not to combine with other laxatives, including herbal supplements and mineral oil. Last, we will cover the stimulant laxative bisacodyl. This drug works by increasing water and electrolyte secretion from the intestines, therefore stimulating intestinal motility. These drugs may be abused by some patients for weight loss purposes, and this can lead to the potential severe complication of atonic colon, as the intestines lose the ability to self-stimulate without pharmacologic intervention. Like before, caution for overuse, as this can lead to rectal burning, intestinal cramping, and diarrhea. Speaking of, we'll now quickly cover medication that can be used to reduce diarrhea. Our prototype medications here are diphenoxylate atropine and loperamide. These drugs are forms of opioids, which can decrease gastric motility and provide some relief for intestinal hyperstimulation. Of course, this type of drug may also lead to side effects such as CNS depression and sedation, as well as anticholinergic effects, since they are muscarinic antagonists. Finally, we will cover drugs used for the treatment of irritable bowel syndrome and inflammatory bowel disease. For the treatment of IBS diarrhea, alosetron is our medication of focus here. However, this medication is unique in that it is currently only clinically recommended for female adult patients. This is a high-risk medication, for despite decreasing GI stimulation and visceral pain, the patient is at risk for severe constipation that can become life-threatening if complications such as intestinal perforation and ischemic colitis occurs. Patients must often sign an informed consent contract prior to initiating therapy. Education should emphasize to report constipation to the provider promptly. In the treatment of IBS constipation subtype, lubiprostone is our prototype. Remember this drug by thinking about a stone getting lubed up. Kinda gross, I know. Vasodilation is increased, thereby increasing stimulation of the colon to promote motility. This vasodilation can lead to side effects such as headaches and dizziness, as well as potential GI side effects including flatulence, nausea and vomiting, and diarrhea. On to drugs that treat inflammatory bowel diseases. First is a sulfa drug, sulfasalazine. Patients should be assessed for the presence of an allergy to sulfa drugs, as well as for sensitivity or allergy to acetylsalic acid prior to the administration of this drug. These drugs, if given after meals, delays the transit time through the GI tract, therefore used to mitigate excessive motility and diarrhea. Side and adverse effects can be severe, including photosensitivity, rash, and blood dyscrasias, which increase risk of anemia, infection, and bleeding. Being a sulfa drug, the patient may also exhibit orange-tinted bodily secretions. However, they should be instructed that this is a non-concerning finding. The final drug of this video are the immunosuppressant drugs, azathioprine, cyclosporine, and methotrexate, which may provide IBD relief if autoimmune disorders and excessive inflammation are related to the cause and symptoms. Immunosuppressants place the patient at risk for bone marrow suppression that could increase risk for anemia, bleeding, and infection. Infection is one of the most concerning complications. With the use of these drugs, even minor infections can become life-threatening. Patient education should emphasize regular CBC monitoring, staying away from crowds and sick individuals, avoiding live vaccines, and reporting even minor symptoms of infection to the provider. Thank you for watching this quick and dirty review of gastrointestinal drugs. While this is far from a comprehensive breakdown, the most commonly emphasized points on the NCLEX and in clinical practice are covered here. Please make sure to utilize your assigned textbooks and modules in addition to this review.
Remember to keep studying and keep working hard.